name's Wes McGraw. I'm an anesthesiologist practicing interventional spine. Grew up in South Webster, and I'm glad to be back in my hometown. When I started medical school, I always knew that I wanted to come back home. We've always been close to our family, so it was great to come back to Southern Ohio. Everybody's been really nice here. It's just the way I remember it, and it's a great place to raise a family. Historically, pain's been relatively not well understood, so it's been very difficult to treat. Opioids came around and seemed like the way to take care of all this, but the addictive potential wasn't really known, and it ended up becoming a real problem. But a lot of the pain that they're trying to treat with opioids can actually be treated with interventional procedures. Interventional spine is not a particularly new specialty. I know people who trained 20 or 30 years ago that have been doing this, but the technology and the way we were able to approach it is much more advanced than it was. Originally when it started, there was no imaging available. Everything was done by landmark. Now we use live x-rays so we can see exactly where we're going. We use ultrasound so we can see the soft tissues. The implantable devices like the spinal cord stimulators, the peripheral nerve stimulators are much more advanced and tend to work better than they ever have before. Basically, patients come in, they have various forms of back pain. We diagnose the back pain and then find interventions, usually blocks or steroid injections or stimulators that can help treat this pain and get them back to their daily lives. Patient develops some sort of pain. They see their primary care, they try conservative treatment, they may see physical therapy, may try massage, things like that, and then the pain doesn't improve. At that point, they usually either get imaging to see if there's some underlying cause that they can identify, or they just go ahead and come to my office, then we send them for imaging and try to find out where the pain's coming from. It can be a musculoskeletal problem, muscle strains, they may have a pinched nerve in their back, they may have arthritis in their back, pain going down their legs, really just about anything. I went to college at Shawnee State University, so you'll need a 4-year degree, usually in one of the sciences, mine's in chemistry. Then I went to medical school in Arizona. That's another 4 years. After that, I matched into an anesthesiology residency at the University of Kentucky. That's another 4 years. And then if you decide that you want to go on to do interventional spine and pain, you'll do a 1-year fellowship. I did mine at Penn State. Happy to be back to the area. I'm currently taking referrals. My office is on Kinney's Lane in Portsmouth, Ohio. My phone number is 991-BACK, and we'd be happy to see you.